Do you experience stiffness? You know, the type that makes you limp the first steps after you sit for a longer period of time? Or do you experience some trouble getting in or out of a car? Maybe tying your shoe or walking has become more difficult. And if you recognize these symptoms, you might be dealing with hip osteoarthritis. Hi everyone, and welcome back to the European Hip Center, the channel where we break down everything you need to know about hip pain, hip conditions, and recovery. In our Hip 101 series, we explain hip conditions so you understand what is happening. Today, we're going to talk about hip osteoarthritis. Hip osteoarthritis is a gradual degeneration of cartilage in the hip joint. Cartilage is a smooth layer that covers both ends of the bone and acts as a shock absorber, allowing smooth movement. It doesn't regenerate easily, but it adapts to load. When cartilage wears down, bone-on-bone contact can occur, causing pain and inflammation. It is important to understand that hip osteoarthritis is progressive. This means that symptoms worsen as cartilage continues to wear down. Hip osteoarthritis becomes more common with age, especially after 60, and occurs more often in women than in men. Hip osteoarthritis can have multiple causes, some of which are also risk factors. As mentioned earlier, age is one of the main contributors of osteoarthritis. As we get older, cartilage quality declines and the joint becomes less resilient. Muscle mass around the hip also decreases, making the joint more vulnerable to wear and tear due to reduced shock absorption and stability. Previous injuries or surgery can increase the risk of developing osteoarthritis. Structural abnormalities such as hip dysplasia or Legg-Calvé-Pectus disease can also lead to excessive stress on the hip joints, accelerating cartilage wear. Being overweight places additional load on the hip joints, which may contribute to faster degeneration. And there is also a hereditary factor that causes osteoarthritis to occur more frequently in certain families. Heavy or repetitive load can also contribute to the wear and tear process. Hip osteoarthritis is more common in women. Hormonal changes, especially the drop in estrogen after menopause, may affect cartilage quality and play a role in the development of osteoarthritis. Many active adults develop early osteoarthritis. Not because they move too much, but because they move with mechanical disadvantages. Untreated cam impingement, hip dysplasia, long-standing labral tears, high-impact sports without proper clearance, and delayed diagnosis can all place prolonged stress on the cartilage over time. And although the hip is incredibly strong, it is not infinitely forgiving. When microtrauma accumulates over the years, cartilage begins to lose smoothness, leading to stiffness. Not constant pain, and that's important. Stiffness is a signal, pain comes later. Pain from hip osteoarthritis is often located in the groin and may radiate to the buttocks or the upper thigh. It typically worsens during movement but can also occur at rest due to inflammation. Other common symptoms include stiffness, especially after sitting for long periods or the first thing in the morning, reduced mobility, and difficulty with daily activities such as walking, tying shoes, or getting in or out of the car. Limping may also occur due to pain and muscle weakness. It's important to note that cartilage itself is not innervated, meaning it cannot directly produce pain. Therefore, its wear and tear can go unnoticed. However, wear and tear can irritate surrounding tissues and trigger inflammation, which contributes to the symptoms. Being told you have arthritis changes how you move. Many patients become more protective and reduce activity because they fear further damage. Ironically, underloading can worsen stiffness and weakness. The hip requires controlled load to maintain functional. We coach patients to move intelligently, not fearfully. Fear avoidance slows progress, while confidence supports recovery. Although I would very much like to say that it is possible, I must unfortunately admit that we cannot reverse the process. To this day, it is not possible to naturally regrow cartilage in the hip. However, this doesn't mean that we cannot protect the remaining cartilage. We can still improve function and reduce symptoms by decreasing inflammation, optimizing biomechanics, redistributing load, and improving muscular support around the hip. Many patients stabilize symptoms for years with targeted strength training, mobility training within safe ranges, impact modification, body composition, optimization, and activity periodization. There comes a point where preservation strategies no longer provide meaningful quality of life. Persistent pain at rest, sleep disturbances, significant loss in mobility, daily functional limitations, and progressive radiographic changes may indicate that a hip replacement is necessary. Modern implants, muscle-sparing surgical techniques, and optimized rehabilitation now allow patients to return to activity such as cycling, skiing, golf, hiking, and strength training. However, timing matters. Replacing a hip too early may expose you to further implant lifespan considerations, while waiting too long can unnecessarily prolong pain and disability. The goal is to find the right balance at the right time. Okay, so to summarize it, the three main things to take away, or for our Dutch-speaking friends, en wat hebben we vandaag geleerd? Hip osteoarthritis is the progressive and gradual degeneration of cartilage in the hip joint, meaning that symptoms worsen as cartilage continues to wear down. The main symptoms are growing pain, stiffness, reduced mobility, and a difficulty with walking, tying shoes, or getting in or out of the car. Symptoms can stabilize for years with targeted strength training, mobility training, impact modification, body composition optimization, and activity periodization. Thanks for watching. If you have more questions or like to know more about your hips, you can follow us here on YouTube for more, or check out our website at www.europeanhipcenter.com. We also have an Instagram page, so definitely check us out there too. See you next time.